The original resource guide was a paper binder that was created for general case management. So we had a lot of staff, and we were addressing a lot of staff turnover as well. And it seemed like there were a lot of resources that weren't all in one place. So we kind of came up with this idea to put it all in one binder, and we started giving it to staff as they came on. So this was their binder to keep, add to, take away from, and kind of do with it what they will, while we also encourage staff to utilize the 211 system and to add their networks onto it. So if they went to Catholic Charities and they met someone, absolutely add that person to the list of people that we can reach out to. So it's kind of an ever-growing binder of information that each case manager had when they came on. So when the agency moved to remote services, they didn't necessarily have that binder anymore, and resources were changing so rapidly. So we turned it into a model in our public drive that had all those resources that were being updated pretty regularly, so that the whole agency had access to this, as opposed to now just community services or just case management. So it started as just a community services case management guide and got bigger to be available to all staff. And we've found that the binder as well has been distributed across other departments now for training.
I'd just like to add, I think for most, I don't know for other agencies, but, turnover is always a difficult situation for us. What we've found in the last few years is that we end up hiring a lot of younger staff people who don't have a lot of connections in the community, or in many cases really, may not have a grasp on all the agencies in our region. And so having that guide available, and Breanne will go into more detail, but breaking it down by what types of resources are available at what agency, and also being able to share contact individuals. So some of the networking that you've done, helping the younger staff to make that connection with individuals that can help walk a client through the process, is really beneficial.
Yeah, to Lee's point, I had come to Connecticut, and this was my first job in social services in Connecticut, so I wasn't familiar with many of the resources around here either. So kind of building that just that base of resources. What can each agency do? Who do we work with regularly? And having it in one place was really helpful for me when I first started here. And as I started to train staff and got into a management position too, we started to distribute it a little bit more frequently, because I wasn't the only one in that position.
So thank you. So with that, you guys kind of touched on a couple of points, but could you just drill down a bit on pros and cons of the tool? I know you talked about a lot of pros tied to utilization of staff across various programs, putting it in the shared drive for other people to utilize, a tool for educating new staff, all pro. What about cons? Were there any cons towards the development or the utilization of a resource guide?
Yeah. So personally, I would say a con is not only for us, like we had mentioned, staff turnover, it happens for other agencies, or they lose funding. So just the ability to make sure that's up to date, because once I have my paper binder, somebody's not coming in to update it regularly for me. So if I don't use the OIC clothing closet, I might not realize it's not open anymore. So just kind of being diligent and keeping it updated, not only the one that you have, but also the one that's electronic, has definitely, I don't know about a con, but a challenge. So it requires regular use to be able to make sure it's up to date. And then the electronic one is the same thing. It's especially with COVID and all of the changing resources, it is a challenge to keep it up to date, and just that having to have someone there to look at it, verify those resources constantly so that clients aren't calling, and that's not available anymore.
Or that we're not sending clients off on wild goose chases, for a program that isn't in existence any longer. Yeah. So, that is probably the greatest challenge. There's InfoLine has full-time staff that do nothing but keep those updated because it's such a challenge. And, you know, with the amount of work that we've got, you know, through all the programs and the additional funds that we're trying to administer right now, that becomes even a greater challenge. But I would say that, you know, once a case manager gets their feet on the ground and gets started, they're also networking with their coworkers. And if you're utilizing that guide to help you to guide clients, you know, you may end up you're going to update that yourself as your reference guide as you go along. You know, so at a certain point, it becomes the responsibility of the case manager themselves to keep their guide up to date. But again, that working together as a team is huge as far as identifying resources that you may not know about or we didn't have in the guide, and any situation where they've determined that our contact isn't there any longer and it may be Joe Smith and not whoever.
And really, sorry, I didn't mean to interrupt you, Cassie. I was going to say these binders are genuinely the case managers to keep and update and take things in and out of as they please. They're not something that we check over. So it's theirs to use. If it works for them, it works for them. If they have a better way to keep things, that's also for them to determine. But these are just kind of foundations that we give them so that they're off to a good start.
No, and I think to that point, what you've created are these living documents that you say to someone, welcome to TVCCA, you know, for your support services. And here's a resource guide to help you along the way to know about any potential partner in our community to help provide services or referral to our clients. But this is a tool that you need to grow with. So as you develop relationships or something else, it's your responsibility to update. So I think that is really wonderful. And I think it's really empowering, if you will. But one of the things that you also mentioned is that there is this resource guide that's electronic out on your shared drive. Who would update that document? Because I can see some agencies saying, well, you know, it's great for the paper, but in this virtual world, who's responsible for updating that electronic guide out there on the shared drive? Who would that be?
So that was me. I was responsible for. I'm pretty tech savvy, and I do enjoy kind of making things electronic. It's just kind of my generation. So I prefer things electronic anyway. I created my first resource guide for my community health worker training, and then when we had to go remote and we needed something electronic, it just came naturally to me. So it was me updating about once a week as we were working remotely. When we came back in the office and we got a little busier, admittedly, we weren't doing it as much, but we found we were sharing more because we're together. I can pop over to the next office. Hey, have you spoken to Catholic Charities? Do you know if they have this available? So it was a little easier and it was not as necessary. And now that we know each other a little better, because we did onboard a couple new staff during this too. So that was available for them to look into, but now that we know them, they can just reach out and say, hey, do you know of a resource for this? So it was me who was managing it. And I had a folder for each, a tab for each, like financial resources, mental health resources, food, CDC resources. Anytime the CDC put out a new information flyer, it was in there in PDF format so that everyone could open it or share it, however. And it was available across the entire agency, still is.
And that was really important at that time. I mean, it still is, of course, but you know, at the start of COVID, when there was so much unknown out there, having those CDC updates that we could look at and actually have some type of information that was based on science, you know, was helpful for staff. And we felt like if we were going to be sharing information with a client, we needed some type of backup to be sure we weren't steering them in the wrong direction. And yeah. I can't say enough about having young tech savvy staff who aren't intimidated by taking on a project like this.
Yeah, and my goal is to make it as easy as possible, too, for staff who maybe aren't tech savvy, or if I'm on the phone with someone and I want to jump into this folder for unemployment resources, I don't want to have to scroll through every single document. So I really wanted to make sure it was folder. You're looking for unemployment, click the unemployment folder, and everything is named appropriately. Food. And so I really wanted to make it as easy as possible for people to find things at the drop of a dime. So they're on the phone, they're trying to find this information, because that's always how it works. So you're on the phone with somebody, you don't have updated information, you need it quickly. So I did try and make it as easy as possible for people to find what they were looking for.
And I think to the point, you've both made some really, really good points, but one of the biggest things that I heard about this electronic version is that you need to have someone who's going to be responsible for it, who actually enjoys doing that level of work. If indeed you don't enjoy updating that electronic document and what the information that was coming down from the CDC, which was frequent and changing tied to that, or if you don't have someone who wants to update it and maintain it and own that level of control, it could really be a problem. So kudos to you, Breanne, for owning that and really just taking it and running with it. So thank you for that. We kind of touched on my next question, but there might be something else that you want to expand out on, if you will. And so the question is really about, how did you integrate the resource guide into your programmatic operations at TVCCA? Was there any work associated with your case management, for example, policies and procedures, or your expectation of your case management staff with the resource guide tool?
In training staff, in my experience, I don't know that we necessarily, and I'll let Lee jump in, or Kim even jump in if they disagree. I don't think we necessarily made it you have to update this. It was, this is what we have available for you. Please take some time to review it, because there is that little window of time where we kind of give people a lot of information at once. So that's our policies and procedures, our handbook, our case management manual to digest. So here's something else that you can kind of review at your own pace. So it's not an obligation that they have to do something. It's just, this is a resource we're giving you to do with it what you will, but we suggest you review it. And that's also kind of, I guess, a little bit of a con is that we have to create that each time before a staff comes on. So we have to update all of that. We have to make sure that's all updated because we're giving it to a staff. So it has to be updated, the paper one. So it's not necessarily there's not an expectation they'll keep it up to date. It's more of a resource we're giving them, in my experience, is how I've approached it. Like I said, I'm not sure if Kim's able to unmute herself. She's hired on a couple of new people recently, so she might be able to speak to how she's utilized that recently with her new staff.
Hi there, can everybody hear me?
Yes.
Yeah. Yeah, it's very similar to what Breanne is saying. As we have onboarded a couple of new staff, they have actually looked at the paper resource guide that we have, and they've made it a point, depending on what their location is, whether it be in the New London region or more of the Norwich region, to supplement that guide and do some of their own, their own research to say, okay, what is it that I'm focusing on as a case manager right now? And I guess I might need to ante up my resources around housing funds, COVID impact funds, things of that nature. So I would agree with that the resources there, and all the case management staff understand how important it is to have timely and reliable resources in that guide.
I would just like to add, Kim has done a great deal of our training for us, with our case management staff. And I think that at some point in Cassie, based on what you just said, it would really make sense, I think, for us and, possibly for other agencies, if they haven't already, to actually nail down a training protocol. We have basic things that we do. Kim goes through the same cycle of activities a lot of times with new staff, but to actually lock that down and have a procedure that we use and check boxes that we make sure we've, addressed with each staff person would probably be worthwhile in the future.
Yeah, and I think too, the more I thought about it, I think that we also, personally, I prefer electronic things. I'm on the road a lot, just being community health manager. So having things electronic is a lot easier for me than having a binder, a big binder of resources. So a lot of my things are actually electronic in my private drive, as opposed to keep updating them in this binder. I'm a binder queen, don't get me wrong. I have a ton of binders. Anybody who's seen me can attest to that, but it's a lot easier for me. So I think that maybe allowing the staff to figure out what works for them, whether that's electronic or keeping that paper one up, is also, it's less pressure.
So that is perfect. And I think to all 3 points, it's really about what is the need of the agency and the staff. And some staff require a lot of attention and a lot of structure. And some staff are like, you know what, tell me what you want me to do, give me the tools, and leave me alone. Okay, deliver, make the world great, that kind of thing. So I think it's wonderful as you flesh it all out. I think it's gonna be exciting as we move this through. So, and that leads into next topic, if you will. And what advice would you offer to CAAs specific to creating a resource guide? The department has heard from a number of agencies that they're thinking about how to create a resource guide, but they don't know where to start. And some people are thinking, well, I'll just use 211, or I'll use Unitas, or I'll use these other tools. But a resource guide is slightly different than those kinds of things. So if indeed someone is thinking about that, what advice would each of you, if you will, offer someone who's thinking about creating a resource guide?
I can start. So I would say maybe sit down with your entire team, because I think the entire team has a lot of resources that aren't necessarily the same. So the first one that I created had tabs. So basic needs, housing, community resources, and I did use a lot of the 211 system as I created it. So I say sit down with your whole team and find out what people have available and add it in that way. And just have your hard copy there and work from that. So have one hard copy and add and remove from that as you go. Because utilize your team. I still, to this day, I go to Kim, I go to Lee, and I say, I have this problem. I don't know where to go. Do you know anybody that could help me? So utilize your team to create it. It's not a one-person job, definitely. Would be, I would say, where you would start.
I agree with that. Definitely a team approach and a delegation approach. We all have case managers on our team that are kind of specialize in things. They might say, I really have a really firm grip on the housing network, or I have our let's say, SNAP outreach case manager might have really a firm grip on food security and all of those resources. So delegate out. And to Breanne's earlier point, maybe have an agency lead that this is really their niche. They really like doing this, have them sort of be in charge, but delegate, to the team. And I think a really important point is do have somebody that is in charge and periodically updating. So maybe the team meets once a quarter and says, we're looking a little old here on this resource guide. Maybe we can, get rid of some things and update others. So, on a quarterly basis, I think making sure the resource guide is looking pretty fresh is a good idea too.
And finally, I would add, once you've got that foundation document in place, it's encouraging that young staff to network. Networking, making those contacts within other agencies, is the way that you get that whole wraparound service for our clients. Every agency, whether it's Salvation Army or Catholic Charities or United Way, everybody's got their own resources, but they're all being administered by different people. And so the more people that you can call and introduce yourself, and I saw your name in our resource guide, and I'd like to just introduce myself. And maybe you could tell me a little bit about the clothing closet. Just establishing those relationships and then updating your guide and personalizing it is going to take it a long way towards, making it a real living document and something that is really beneficial to you and your customers.
Perfect. Thank you. So my next question, and again, it's for all three of you, Kim also, in your own words, if you will, could you describe the value of a resource guide within the auspices, if you will, of case management or community health worker activities? So all three of you, so whoever.
Yeah. So like I mentioned, when I started at TVCCA, it was really my first opportunity in Connecticut. Prior to, I was in Rhode Island, so I knew a lot of Rhode Island resources, which are completely irrelevant here. And so creating a guide really helped me to understand what Connecticut had to offer. And I did that before I even started working with clients. So I was kind of building that on my own before I started working with clients. What's available? Where can I send people? While also understanding what TVCCA did internally. So it was invaluable to me to just kind of take that time to learn what Connecticut had to offer. And in terms of community health, things are ever changing in community health. And I'm the only one that maybe does a lot of the things that I do in the agency, but just having that knowledge it's helped a lot of other people who get these one-off situations that I deal with every day. So they're able to reach back to me and say, hey, what do I do with this situation? And I can say, I have this resource, give them a call. So I can provide those resources for those one-off situations. So it's been invaluable in the work that I do and my ability to share the information, because I have a physical resource available to share with someone, or a contact to share with someone when they're not quite sure. So both have been invaluable to me and the services that I provide.
Kim?
Anybody
Yeah,
else?
I don't necessarily have anything unique to add to that. I think Breanne pretty much mentioned all those talking points. I think, and on our agency, our case management team are predominantly community health workers as well, certified community health workers. We have one person who's going through, one of our case managers who's currently going through community health worker training right now. I think that additional resource as a community health worker, because it's a little different, and integrating that into your case management practices has I think become very, very natural thing on our team. It really has. So that resource guide, I think, is as we continue to sort of shift our response, we'll see more things in our resource guide that have to do with meeting the needs of being a community health worker for our customer base. So that's an interesting, the last 2 years, that shift. What are basic needs now? We're redefining things, and that's exciting, I think.
Yeah.
And I guess I would just add from the managerial standpoint, I really feel for young staff who are just starting out and taking that first phone call and being hit with a client who's, in a real crisis situation, and they're looking to you for resources, and you're stumbling because you don't know what's out there. And having that luxury of being able to flip to tab 3, and there are the recent housing programs that are available, and a description of CARES money, and oh yes, this individual's income fits in with this particular program. So for our newer staff who are just getting oriented, it's a huge benefit, and really makes a difference for them in their confidence level and the provision of services that they're providing.
Well, that was perfect again, because that's what I was thinking in my head, but I'm like, well, that's only in your head. You know, that may not be the actual reality of what's going on at TVCCA. So, you know, thank you for that. And the last question, and then hopefully we'll lead into questions and communication from the attendees, is really around, are there other comments that you would like to share with the attendees that we may not have touched upon during the interview process?
I think we touched on, in my opinion, I don't know if everyone agrees, we touched on how it's created, how it's used, and really how we're adapting it over time, because that's exactly what it is. Like, it's a living document, like Lee said. You've got to keep on updating it. And so how are you updating it? And like Kim said, assign the one person to do it on the electronic version, and then it's the staff's responsibility to keep theirs updated if they would like to. So, I mean, I think we touched on kind of how to create it and how to keep it up to date.
Well, then the floor is open for questions. If anyone has questions, the theory behind these sessions would really be that it would be a half an hour to 45 minutes, depending upon the conversation and the responses. And then we'd have time to just talk things out, because this is about, again, talking to peers. And so we can get started. People can raise their hands and we can go from there. So Betty raised her hand.
Yes, I do have, when we define staff, because our staff is very diversified. You might have someone that's in the dealing with the clothing. You might have someone in the food bank, and you have the energy. You have your energy of people doing the energy intake. So, and many times there are clients that come, there are potential clients that come to the door that need services, and we don't get them, and they don't come into the mainstream of the case management. So would a energy person, an energy department, be able to go to that resource if someone is talking, say, yes, that is available, and they can go in and pull that resource and then send them to whoever that is needed? So is it available for entire staff, or is it just for case management?
Yeah, so I can answer that. So the electronic one is available to all staff throughout the agency. It's in our public drive. So all of the tabs that we mentioned, like the housing, the mental health, the unemployment, they're all available throughout the agency. Anybody can open it up, find what they're looking for at any time, no matter their position.
The interest, one last thing, comment, the portal to our services will be your receptionist, whoever is taking information. So, and so when people call and they say it's something that there might be additional resources out there other than us. Maybe we are not the appropriate portal for them to come to us. They will be able to go in and say that this is available. We do not do that, but there is an agency that does that.
Yeah, yep. Usually our front desk, our receptionist will connect them to a case manager. We usually have a case manager available pretty readily, or a manager available that can help make that connection, or see if there's anything else we can help them with internally, and kind of link all of the available services. So maybe we can't do everything, but we can do a small piece of what they're looking for, and another agency can do another piece of it. But we usually have a case manager available for things like that too.
Perfect. So Anastacia had her hand up.
Yes. Hi, everyone. I'm Anastacia from Opportunities. So I actually have two questions for you guys. So when I was a housing case manager, I actually attempted to do this. Do you guys provide this resource guide to clients as well? Because when I was trying to do it, it was more in a paper format, and it was just hard to just update. So are you providing this to clients as well?
It's not something that we provide to clients. They're pretty substantial documents. And, we've got some trifolds of general TVCCA services, but the goal is that, we're going to connect that individual with a case manager who can walk them through and, and connect them to the services that are available. But it'd be a little unwieldy to do that.
Gotcha. Okay.
You know, and I guess we probably would direct somebody to 211 if they wanted to navigate themselves.
Yeah. So typically what we used to do is when I was a housing case manager, we would provide it to clients that we were discharging from the program so that if they need additional services, they had this packet that they can refer to if they need to re-engage.
Oh, that's good. Yeah.
And my second question is, how in depth is this resource guide? So are you guys providing just like a name of an agency, a contact person, and a phone number? Or are you identifying what criteria is for that specific program? Or is it just a person they're reaching out to?
Usually it's a person they're reaching out to. And so we will give them, so for example, Safe Futures has a clothing closet. So we do have the referral form for the Safe Futures clothing closet. So we'll help them fill out the form, we'll send it out, and then we'll give them a phone number to call, knowing that that closet is still open. So it's usually just a name, a phone number. These people have this service available. I don't know that we would be able, I don't know that it's realistic to keep up with their income guidelines or all of their nuances necessarily in terms of like family size town. So we usually give them that name and phone number and have them reach out.
Gotcha. Okay. Thank you.
Many years ago, Anastacia, we did try to do that, and it became outdated so quickly, you know, that it wasn't valuable to the case manager after a while. So the more data you add to it, the more information, the more work it comes to keep it, you know, keep it up to date, because programs change so frequently. So yeah, that becomes a real challenge the more you add.
Yeah, I definitely agree. That's something that we struggled with as well. Thank you.
You're welcome.
So are there other questions? I don't see anything in the chat. Now, I don't see any hands raised, but I did want to make sure that we provided everyone with a opportunity to think about the feasibility for those agencies that are thinking about it of the resource guide. What would be the bandwidth within your agency? So for example, tied to Anastasia's questions of eligibility. And as the TVCCA team said, that's quite a bit of work, especially with things are changing. So for example, with DOH, they have money, they don't have money. They do have money, they don't have money. Tied to food pantries. Food pantries might be available depending upon what your town looks like on Monday, Tuesday, Wednesday. But on Thursday, the food pantry that is kosher is open. So it might be something that food pantry kosher food might be in the resource guide, but the income requirements may not. So it's understanding those little nuances of the programmatic services. But as we think about this, with everything that's been going on with the pandemic, with people approaching your doors and needing assistance. And so when people are approaching your door and needing assistance and you can't provide that service in-house, it's one of those things to think about. What is your staff doing? Do they have a tool that they can look in to see where can I refer this person? Or are they looking around unsure what to do and saying to the customer, hold on, I need to go talk to somebody. Hold on, I'll be right back. And then they go ask a coworker. So as you're thinking about that, right now is when, if indeed such a tool existed, it could really be beneficial and help reduce stress on your staff as they're thinking about what to do with this person or this household, and I can't help them. How do I provide them help that feels like help? And so that's part of the reason why we wanted to have this session, to get people thinking about it. Again, it may not work for all agencies. You've seen one CAA, you've seen one CAA. But sometimes we can learn from what other people are doing and not have to reinvent the wheel. They've done the heavy lifting from you. There's no shame in co-opting. I do it all the time. Yeah. But again, just thinking about it all, we just want to encourage people to start thinking about it. And, you know, Betty's question tied to, hey, can our receptionist, you know, does she have the ability to be able to say when someone's calling, you know, I'm looking for, let's say, let's do the easy one, food again. Do we really need to refer that person to a case manager to do the initial assessment, or is the receptionist able to do that? So if indeed she had such a tool, that could perhaps, depending upon what your model looks like, reduce the number of calls that are going in for the case management staff. Also tied to the energy assistant staff. And remember, paper moves, people don't, but tied to that piece of it, while the energy staff person is assisting the person, let's say they're coming in and we are talking about, we're not talking about Operation Fuel, but someone might have a water bill, for example. If indeed you're in South Central Connecticut or Derby or something, there is this water assistance fund. Well, it's a little known fact that the case management staff might know about it, but the energy assistance staff may not. So do you take the application? You know, how does this all work? So as you're thinking about this kind of stuff, it's about empowering staff to be able to help customers within one stop and not having so many different things. I will tell you, I get WIC, and WIC is clearly, I only pay for WIC. I'm not paying for anything else. That's it. So also, it's important that the case management staff or whoever is doing it understands the limitation of the funding streams. It's good to do a referral, but WIC is clear. I don't want you doing any other work than other WIC documents. You know, WIC says do A, B, and C, and WIC only wants you to do A, B, C. Anything else, even though it is, let me take this energy assistance application because you've identified this energy burden, that's too much work. So we're not saying put your resources in jeopardy. We're just thinking about how do we assist the client that is presenting a need while reducing the number of hops that the customer needs to make.
And I think what's important too.
So I don't see any other hands up. I'm sorry, go on, Breanne.
I was going to say, I think what's important too about us is we kind of go off a no wrong door model here at TVCCA. So we have interdepartment meetings that we say, like every pre-COVID, we had interdepartment meetings where we could present what we had available, generally speaking. So if a WIC person, WIC client did come in and they said, oh, I also have a, because once they're talking, they're gonna say everything oftentimes. So they say, hey, I have a back electric bill, like I'm really worried about, then the WIC staff can walk them to the front desk to make an appointment, like on their way out. So WIC is aware of how we have energy assistance, we have case management, we have somebody that can help them with the SNAP application. So that's kind of how we make sure we're still meeting the needs. Where WIC isn't going to do that energy assistance application, they can quickly connect them to someone who can do that. So I think that's also been a huge help within utilizing resources in our department, like those interdepartment meetings.
Yeah, I think, Breanne, you know, we have a luxury at TVCCA in that all of our direct client services are on our first floor of our two main buildings. And so really that linkage between, you know, for example, a WIC client, you've got case managers right on that same floor. And, you know, we're lucky enough because of the structure of our building where those kinds of linkages happen. Well, we've encouraged them, but they've also happened organically because people know each other and staff develop relationships between each other and programs. So, you know, it absolutely benefits us and our clients.
Well, that is perfect. And Sarah just put something into the chat tied to during the CHW work. Yay for all of the CHWs out there. That one of the things that CAWC created was a resource guide, if you will, specific to their area. So Sarah, can you just talk a little bit more about the guide that you created? Was it part of your CHW credentialing process or just something that organically developed as you were going through the CHW training?
Well, when we begin to attending the training, I already have created my book and I call that book my Bible because it's all resources available in Connecticut area. It is not only one for the area where I was working, Norwalk, West Stamford, because sometimes clients move to other areas and maybe they going to New Haven. So I have resources for housing in New Haven. It is not only one book about one specific area. It's like my coworker says before, is the entire information for Connecticut. If we have this in, in a version where we can get access and everyone has update of that information, is going to help a lot with your clients.
So thank you, Sarah, for sharing that piece of it. And just again, so did you develop it during the CHW training, or was it already done and then during CHW you expanded it out for the agency to use?
Actually, give me a second and I show you a little bit. As you can see right here, I begin to working and do a specific like a binders with housing information, case management information. So when the program become to span, is more and more documentations we have to, updates. I use my amigo Google for all resources I need to do updates, but sometimes I have my handles Bibles with me because help me a lot through the case management services. And actually the other thing is doing outreach. When you do outreach, other partners, what they doing, what services they are doing. As a part of we are community case workers or community services specialists, every week we do outreach. So for to know new partners, to know what is new in the area, what services are available to try to help better with your clients.
Well, thank you. I think what you showed is that sometimes these things just organically just generate, and it might have started out as just something that started out with housing and then it grew beyond the housing concept. And I think the other part is this constant theme, as you heard from Breanne and Saira, CHW, all of that level of work tied to the initial training that the network did in an investment that the department had within the CAA network, and then how it's paying dividends now as we provide services to our customers. So kudos again to all of the CHWs out there that are doing that level of work. Okay.
I just want to add that that's our Saira and you cannot have her. Just wanted to know that.
Yes, Betty, I know. So are there other comments or questions? I don't see anything else in the chat and I don't see hands raised. Again, feedback once we're done, just shoot some feedback and let us know, yes, this worked, no, it didn't, keep this up, stop, don't do this anymore, don't do trainings during lunch, I'm about the food, I only got this, whatever it might be. Okay.
I think this was very nice. We get to at least see some faces, put names with faces. So since we can't get together in person, this is nice. Yeah. Like
Thank you,
that.
Betty. Yes. Okay.
I just wanted to say really quickly, Cassie, before we sign off, we've sent out the registration links multiple times and we're not shutting those down at any point. So if you haven't had a chance to sign up for the other trainings, conversations this week and you want to, please feel free to go ahead and sign up. Those are all still open. And if you're having any issue at all registering, send me an email and I can send you the direct meeting ID so that you can just join that way as well.
So before we go, Anastacia put a comment in the chat and I just want to make sure about, can you share with the group, is it the tool tied to a skeleton, the resource guide, the question? All right. So one of Anastasia's questions is that as a skeleton, is there any kind of skeleton as a resource guide that you all could share? That would be Saira, as well as the TVCCA team that have it, just as a skeleton. So agencies can build off of that and customize it for themselves. So is there maybe an outline? Because I know it's TVCCA specific, but is it something tied a little intro, case management, housing, food, clothing, mental health, substance abuse, those kinds of headings. And I know every catchment area is slightly different, and what might be going on in Norwich is slightly different from New London as it creates itself. But also Anastacia has the challenge or opportunity because of the 3 different catchment areas in Waterbury, or the new opportunities area. What's going on in Torrington isn't the same that's going on in the Nagam area or Waterbury area. So when you're thinking about these kinds of resource guides, you know, that might be something else that we really didn't talk about, but we have like 10 minutes left. Did you find a challenge, the TVCCA folks, tied to when you were doing your guide? Did it include the New London and the Norwich catchment areas, or just very general? And then when you gave it to the staff, they personalized it for their own individual catchment area.
The first one that I made was, so I actually did my CHW training in Western AHEC. So my first resource guide was actually for Western Connecticut, but my next one was for New London County. So I just did all of New London County, mainly because it's not uncommon for somebody who lives in Norwich to come to New London, just because that's maybe the office they prefer. For a little while, our Norwich office, you had to go upstairs to get to the case managers. So New London might have been a little bit easier for them. So the resource guide just has all of New London County. The one that I've created and the one that I still distribute just has all of New London County. And from there, you can kind of pick and choose based on the client you're sitting in front of.
Perfect. So Eve asked a question or made a comment, and I'm not sure if it is in each of the resource guides or not, but is it possible that a resource guide should include at least a contact from each CA? So if indeed your customer says, I'm moving from New London and I'm going to move to New Haven, if indeed with them moving and transferring over, is it possible that the warm transfer should be given of, and here's the name of the CA, or here's a contact for the CA? And that was one of the items that she had asked about as a handoff. And I'm not sure when your customers leave, if indeed they're leaving with the services provided and we're closing out the case as in successful, or if customers are exiting and not successful because they're relocating, tied to that level of transfer. So that was one of the comments that was put in that Eve was asking about.
First, as far as the guide goes, I think that's a wonderful idea to include something like that. You know, so our staff would be able to direct individuals to the community action agency in the area where they are moving. But if they were leaving our service catchment area and we would not be providing services for them any longer, we would be closing out those service plans.
Perfect. So what I will do is I will work with CAFCA to check with the entire CA network to have them identify one person. So if indeed a customer who is exiting your catchment area and going into another catchment area might still need services, who might be someone that they can refer to? Would it be just go to the CA and here's a phone number and call? Or would it be, you know, here's a person to contact as you transition? So I'll work with CAFCA on that for next month, and we'll share it at the planners meeting. And you use it if you need it. If you don't worry about it.
But if you have the resource and it's electronic, even if they don't have it appears to me, even if they don't have a contact person, whoever answers that call would be able to answer the question because the research guide is there. So it wouldn't really matter because everybody's educated.
Well, that would be true, Betty, as long as someone has the name of the CA and a phone number in theory, because, you know, we CAs, we pick up the phone when it rings. Hello, hi, welcome to TVCCA. How might I assist? Blah, blah, blah. So that, to Betty's point, you know, maybe we don't need a name. All you need is a phone number. That way, because if people are fluid, the phone number is at least going to be consistent and stagnant.
There you go.
So I'll talk it over with CAFCA and we'll make the determination, because again, all of the contact information already exists and lives on the CAFCA website. Do we need to do something else? So it'll be something that we'll talk about and go from there. Hey, Ida Parker, I haven't talked to you in I don't know how long. Hey, housing and house. Anyway, sorry. Sarah also put something in about Unite Us and that referral type services and everything else like that. And so that's something, and 5 minutes left, so I guess I'll just go on to my usual tirade. Unite Us is something I'm always challenged about because of the fact that Unite Us is more health focused from that hospital kind of thing. So what happens if indeed people are not from that health focus and they need other resources? What happens to those persons then? And so it is one tool, but I like to encourage people to think about multiple tools and not just one tool that might be specific to someone that might have a health barrier that might be discharged from a hospital. And then other CAs are not utilizing the Unite Us tool because their hospital isn't part of that group yet, because Unite Us is doing that slow rollout, if you will. So that's the other part. So we have 4 minutes left. I'm not sure if anyone has anything else. Betty, stop laughing at me. If anybody has anything else to say, Sonia,
I was going to ask you to repeat that question. I was going to ask you, could you repeat that question? You know, that takes 3 minutes.
Oh, well, it appears that we are actually done. I think everyone, from what I'm seeing, kind of enjoyed this kind of format, this presentation of Lunch and Learn. So yay, we might be doing a spring session and reaching out again. If not, again, feedback is important. If it didn't work, you need to say, this didn't work for me and why. No one gets hurt, then we don't waste your time. But if indeed, based upon everyone saying, this is perfect, keep it up, and you're like, no, don't keep it up, we need to have a balanced kind of feedback to go. Thank you, Sonia. All right, everybody. Thank you very much, Katrina. Thank you, Lee, Brianna, and Kim. Thank you, thank you, thank you. This was wonderful. Yes.
Thanks for the opportunity.
Thank you.
Hopefully
Yes.
see you all tomorrow.
Bye-bye.
Bye-bye. Thank you.
Hi, everyone.
Starving.